So welcome to this 7th episode of Create Connects. Before we start, I would like to acknowledge that all of us here are located somewhere on Aboriginal land across this vast place now called New South Wales. I live and work on Gadigal and Bidjigal lands and pay respects to elders past, present and future. National Authority Day was on Tuesday this week, and I'd like to acknowledge and pay respects to any Aboriginal and Torres Strait Islander people that are joining us on this platform today. My name is Beck Dean and I'm a Manager of Arts Funding and Development of Create New South Wales. There are two of my Create New South Wales colleagues on this platform, Marilee Ray and Ivana Jovanovic, who will be helping us to moderate questions as we go. On May 20, the New South Wales Government announced that museums, galleries and libraries in New South Wales will be allowed to reopen to the public from June the 1st with appropriate measures in place to ensure a safe environment to work in and to visit. So this webinar aims to bring you factual, useful information on reopening museums and galleries in particular, as well as some case studies from the sector. So, I would like to let you know that there's an opportunity to ask questions at particular moments, which I'll indicate after presentations. So we're joined today by guests from New South Wales Health and the New South Wales Gallery and Museum sector to talk through the important details of this announcement, including updates to New South Wales public health orders and approaches to reopening. I'd like to welcome Dr. Michelle Kretikos from Ministry of Health, Emily Crocker from Art Gallery of New South Wales, and Julie Baird from the Newcastle Museum. Thanks so much for joining us this morning. But before we start, sorry, this is a very long preamble. I won't talk the entire time. I really want to address all of our participants online today from the museum and gallery sector, and to acknowledge the disruption of your regular operations over the past months, to say thank you for all your hard work over this time and for the adaptations that you've made to your programs and to your workplaces. So we hope this information can help you through what has been a very tumultuous moment. Firstly, Create New South Wales would like to urge you to specifically engage with New South Wales Health guidelines in relation to COVID-19 and the reopening of your spaces. The federal government and every state government has produced different information on reopening and the easement of COVID-19 restrictions in their particular jurisdictions. But please make sure you are following New South Wales Health guidelines and keep up to date with these as changes to health advice will continue to happen over the coming weeks and months. Secondly, we'd like to get you to get in touch with us, specifically with me, about your reopening preparedness. I'm going to put my email address in the chat box, and we'll also have an opportunity to write this down at the end of this session. We understand that every organisation has a different set of stakeholders, different communities that you serve, different kinds of programming and experience that you're offering to visitors. So please make sure that your planning is compliant with health orders and it also suits your purpose. This may mean that you're not yet ready to open now, and this is okay. The advice from government is that it's permitted to open from the 1st of June, not that you must open from the 1st of June. So now I'd like to hand over to Michelle Kretikos. Michelle is the Executive Director of the COVID-19 response within the Office of the Chief Health Officer, New South Wales Ministry for Health. Michelle, hope you're there. We're really grateful that you can join us today to cover the reopening of galleries and museums from New South Wales Health perspective. And if you can please take us through the New South Wales Health checklist and any other information you may be able to provide to the sector at this time. Thanks so much.
Sure. Thanks, Beck, and good morning, everybody. And I'd like to echo Beck Dean's initial comments about your patience, and thank you so much. I'm sure that you've had a very difficult few months, and I hope that this is very good news for you, and I hope to be able to provide the guidance to you that you need to allow you to open as safely as possible. The first two things I think to note are that there's two main obligations on all businesses, and this is for across the board. The first is that everyone needs to comply with the ministerial directions as they are in force under the Public Health Act, and that the second is that everybody needs to continue to meet their obligations under the Work Health and Safety Act. In relation to the first, which is the ministerial directions, there's only one major component that really relates specifically to museums and galleries, that is a mandatory obligation, which is that your capacity must not exceed 1 person per 4 square meters. There's a range of other information that's provided in the checklist, which is guidance to you to assist you to develop a specific tailored COVID safety plan for your premise and for your context, and to assist you to ensure that that is done in as safe a way as possible, and will assist you to meet your work health and safety obligations. But as it stands under the mandatory obligations under the Public Health Act, the main obligation is to not exceed 1 person per 4 square meters, which is your premise. However, there is a little bit of complexity for some museums and galleries that may be larger, that may have cafes and restaurants, for example. There's specific additional obligations that you would need to ensure are in place for those, as well as at this time, additional facilities that you may have, which include theatres or cinemas, are not permitted to open, but that your main museum and gallery is permitted to open. And restaurants and cafes are permitted to open if you have those, but they have specific requirements. So all businesses are being asked to develop a COVID safety plan to describe how they will meet the obligations under the Public Health Act, as well as how they will meet the guidance in the checklist, and that they've to demonstrate that they've considered all aspects. And the key aspects that everybody is being asked to consider, all businesses, include particularly focusing on the well-being of staff and visitors. Particularly important to develop some form of process that would assist you to inform staff and visitors that they should not attend work or should not attend the premise if they are unwell with even the mildest of symptoms, and consider how that would be implemented in your premise, particularly in relation to symptom screening or signage or temperature checks, depending on what you feel is necessary, and probably depending on the profile of people who come to your premise or to your location. Providing staff on information on how to get tested, and that they're aware that they have leave entitlements and they are required to self-isolate if they're sick, because probably the biggest risk to anybody and to any business is people who are sick attending work or visiting or participating in the activity while they're sick. So those clear display of those conditions, and particularly making sure there's no disincentive, so people who have booked or who are intending to attend have no disincentive to not attend if they're sick for whatever reason, and that's all about the staff well-being and visitor well-being. The second thing, which is very important, which is the physical distancing, and that's where the mandatory obligation comes in immediately around the 1 person per 4 square meters, which is on average across your whole premise. But then there needs to be a whole range of other measures in place to try and ensure and encourage and promote that physical distancing around the whole premise, which includes, for example, implementing a time-based booking system to limit the number of people entering the premises or waiting outside, or considering electronic ticketing to reduce contact, calculating your area and ensuring that there's some limit on those who can safely occupy the space, using signage and considering the direction of flow of customers so that there's not unnecessary mixing or mingling of people within the premise. Removing tables and seating as required to promote the 1.5 meters physical distancing, and that tours should involve no more than 10 visitors per group. There's a range of other suggestions about using telephone or video for essential meetings, wherever practical, staggering start times and breaks, reviewing deliveries and having strategies in place to manage the gatherings that may occur immediately outside the premises. And where practical, any food and drink premises do need to have measures in place, as I mentioned before. So then there's hygiene and cleaning, adopting particularly focus on good hand hygiene practices, ensuring that there's very good hand hygiene facilities and or the availability of hand sanitizer if that's more appropriate for your location. Ensuring that particularly the high touch surfaces are cleaned regularly with detergent or disinfectant, and that includes handrails, doors, buttons, that sort of thing, as well as making sure that cleaners have the appropriate equipment such as gloves to keep them safe, and suggestions about limiting use of cash transactions, and other specific recommendations about interactive exhibitions, which should probably be very carefully considered or else supervised by a volunteer or staff member if that exhibition needs to continue, and ensure that anybody who does touch an exhibition that there's hand hygiene before and after, and that the device or the exhibition is cleaned if it involves touching. We suggest considering removing printed museum and gallery guides and replacing with downloadable guides or audio guides that can be accessed by the visitor's personal device. And the final major category is about record keeping. And so the intent here is that if there is a case with COVID who attends your premise or in a staff member, that you would have a very good record of who was in attendance that day, and that would facilitate public health follow-up. So to keep a record of the name, the mobile number or email address for all staff, volunteers, visitors and contractors that have attended your premise or your location for a period of at least 28 days to maintain that record, and ensuring that it's stored confidentially and securely. And we would only ask for that information if it was necessary to understand the potential contacts of a case, if that was not able to be recalled by the person when they're being interviewed. And you should make staff aware of the COVIDSafe app and the benefits of that as well, but that's not an enforceable or something that should be done without. It's a person's decision as to whether they wish to use that app. So those are the key categories in the checklist. As I said, the two overarching things are the ministerial direction and work health and safety obligations, and then the specific thing for each premise or for each museum and gallery is to develop your own COVID safety plan that addresses your own circumstances with regard to the checklist, while making sure that the mandatory obligation of the 1 per 4 square metre is applied at all times.
Thank you so much, Michelle. I will, because there's quite a few questions coming from participants. I will now direct some of those questions to you, Michelle. Nick asks, some facilities are multi-purpose. For example, a museum may include a children's play area. How is that best managed?
So that will then get down to your assessment of how many children are likely to be in that area at any one time, whether physical distancing can be maintained, especially for children, whether you've got the resources to dedicate a volunteer or staff member to oversee that facility to make sure that it's safe, or whether, in your opinion, it's better to close that component for the meantime to maintain safety.
Thanks for that, Michelle. And Cameron asks, when will the checklist for libraries and galleries be finalised and published, sent to them?
Yeah, I understand and appreciate everybody wants the checklist, and we wish we could provide it immediately. The public health order is yet to be finalised and signed, and until that is done, we can't really release the checklist because there may be some small change that occurs which then has an impact on the checklist. So we will release them probably concurrently. As soon as the order is signed, then the checklist will be released. If it's any assurance, this is the same for all businesses and all premises. The same situation. We do apologise for that.
Thanks, Michelle. Bronwyn Coulston asks, the media release from the 20th of May about opening galleries notes there are to be no groups or tours, but Michelle stated tours or groups of no more than 10 can be allowed. Can we confirm if groups are allowed or not in this first stage of opening?
So currently under the public health direction, gatherings of up to 10 people are permitted. So we've continued that same logic in that if you are having groups, there should be no more than 10 people in the group.
Thanks, Michelle. Carolyn McLeod asks, there's been conflicting information provided to libraries about whether names and addresses need to be kept. How does this work with the collection of name and details for children under 12 years old?
So we do ask that you keep a record of the name and contact number of all people entering the premises. If it's a family that enters, it would be helpful if all of those names and contact details were captured. But in reality, if it's a household, if we can get the name of the parents and the contact detail of the parents, then we would almost certainly be able to trace the whole family. So the intent is that we're able to trace people. If you feel most appropriate to just capture the parents in a household, then that's fine. But if it would be helpful if at least the names of the people who were in attendance were captured, so we could be sure, confident of who was there and who was not there.
Thank you so much. There's a couple more questions about the obligation to collect visitor details, and so I think you've covered that. Rebecca Turnbull asks, what are the guidelines for volunteers returning, especially for those over 70?
So there's a range of people who are probably more vulnerable to severe disease if they become infected. There's certainly very clear evidence that people over 70, if they become infected, are more likely to have a severe outcome. And so we are providing advice that those people take particular care, carefully consider whether they want to continue to participate in any activities that increase their social contact. That is a matter for them and a personal decision as to whether they feel that that's appropriate. And if they do wish to continue volunteering, then additional precautions, trying to make sure that you don't come into close contact with a number of people through the day, perhaps considering what type of volunteer position or what type of volunteer service you would be comfortable with providing, and whether that can be considered as part of your overall service plan to ensure that those more vulnerable people are offered as much protection as is possible within that decision, which remains a personal decision.
Thanks, Michelle. There are a couple more qualifications I think that people want around collecting data of visitors. One from Tim, how do we manage privacy concerns if we are to provide contact details to health?
So this is part of the public health approach, and the reason that we would ask for information would be to assist with the public health investigation. So if you were asked to provide information by New South Wales Health in order to assist with identifying contacts, you would be covered in terms of that's part of a public health investigation, and we are asking for the reason of protecting public health. So if you collect the records and store them securely and only provide them to a public health official, which may be a member of a public health unit or maybe a member of staff from the Ministry of Health, for example, for the purposes of understanding who was present to assist with contact tracing, then you would be perfectly, everything would be perfectly fine.
Okay, so there was another question about the legality of that, and I think you've answered that. A question from Paul is the collection of personal data essential if visitors have the COVID app?
So we would prefer that everybody does keep a record of everybody who has entered. Technology is great if it works. We don't know that it always will work under all circumstances, so we would like to keep that record. People may not have their phone on, the other person's phone may not have been on, so we do think that this is an important way to ensure that we can contact people should it be necessary, and that contact tracing is a very important part of the public health response and has been very successful to date, but it does depend on having a good understanding of who was present, especially if it turns out to have been a high-risk situation and there may have been multiple people exposed.
Thanks, Michelle. There are a couple more questions around this. Again, on the young person issue, Caroline's asking if a 12-year-old is able to attend by themselves, then what are the sort of legalities around collecting their information?
So I think, as with everybody, you have, we would be suggesting that you comply with the COVID safety checklist, which includes asking people for their name, contact details and email addresses. We're not actually asking for their address, their physical address, and it's, I guess, up to a person to determine whether they provide that information. It could be explained to everybody that this is for the purposes of assisting a public health investigation should it be required, and will only be provided to a public health official for that purpose. And then I guess if somebody refuses to provide, then that's their right. And maybe it's about the framing of it and the way that you ask.
Thanks, Michelle. And I think another question, just to clarify whether collecting names and contacts is mandatory or recommended.
So as part of the overall legislation, we are asking you to develop a COVID safety plan that it has regard to the checklist, and the checklist specifies that it's recommended to keep a record of everybody's name, including mobile number or email address. But the mandatory obligation is 1 per 4 square metre rule, and everything else is have regard to your circumstances, and these are all the recommendations, noting that you do have obligations under the Work Health and Safety Act, which pertain to all staff and visitors. And so we would suggest that one of the aspects of keeping people safe is having appropriate records so that they could be contacted as necessary.
Thanks for that. There's a question about visitor information centres. That initially in the announcement, visitor information centres were included in the order. However, the order to open does not include visitor information centres. Do you have any information on visitor information centres?
I can't provide any further information about that at this time, I'm sorry.
Sorry, just another question about when the health order is due to be signed, noting that councils won't open premises until they get a checklist.
Again, I'm sorry, it's a process that goes to the Minister, and I can't actually provide an indication of when that might occur.
And a question from Nick, is online ticketing mandatory, and does that mean just scheduling your visit, or is it also the mechanism for capturing contact details?
So it's not mandatory, but it's a suggested process that may assist both with monitoring and managing the flow, the numbers of people into your premise, as well as obviously a streamlined way to capture those contact details. If it's not appropriate for you for whatever reason, then an alternate process would be to capture that information in a piece of paper or book physically as people attend the premise, especially for a small gallery or museum. So that's the reason why the checklist is meant to provide guidance, and it allows you to make the best decision as to what's appropriate for you. Obviously, if you're a very large venue with high volumes, then the online ticketing may be the most appropriate.
Two more questions from Paul. He asked, does the maximum of 10 people in a tour include the tour guide?
Let me see. Let's say tours should involve no more than 10 visitors per group.
Great, thanks for that. It's pretty clear. And the next question from Gayleen is, if we have unmanned museums, what is the suggested method for collecting contact details?
So I guess to have an online booking system may still be possible, or an online registration for those who are attending, but if that's not possible, then having a book out front at the entrance with a clear sign to say, please record your contact details. as you enter the museum if there is no staff on site, and if there's any other way you could make that clearly communicated to anybody who does enter the premises.
The next question from Lauren, I think possibly potentially is confusing the 10 people rule with the square meterage rule. Does the 10 people rule apply to function centres, learning centres and meeting rooms? And can these go ahead to face?
So the 10-person rule is meant to apply to what would be considered a gathering. So a group of people of common mind that are attending for a common purpose. So if you're attending as part of a tour, then you're kind of a gathering, and that's the limit on that group. The 1 per 4 square metre rule applies to everybody that's in the building. So it's meant to be a sort of total capacity, the total safe capacity of the premise, which includes staff and visitors.
Yeah, so that means, I guess, if your function centre and your learning centre doesn't have that square meterage capacity for 10 people, then it would have to be less than 10 people.
That's right. So you would not be permitted to have more than whatever the actual total capacity of your space is.
Great. Thanks for that, Michelle, and thanks for answering all of those questions. I guess we're, trying to get the detail together around this. Sorry, another follow-up question from Lauren. We can have meetings and function centres open? Is the question.
This will partly depend on how the order is written. As I said, I haven't seen a final order, so I can't be definitive. I would imagine that it's the same rule, the same logic about up to 10 people in a gathering. So if you're having a function, that would be considered a gathering. So it would be the same as a tour group. And that also you need to consider the restaurants and cafes. So if you're providing food and drink services, you would need to consider that separately as well.
Thanks, Michelle. I think that's all of the questions that we have from the sector for the moment. Michelle, thank you so much for joining us today. I can tell that it's all very busy in your office at the moment, and you probably need to get back to that urgent work. We do really appreciate your time on this. It's wonderful to have you join us today. Thank you so much.
Thank you, and thanks for the opportunity.
Secondly, we have some case studies. We have some wonderful people from the museum and gallery sector joining us now. Firstly, I'd like to hand over to Emily Crocker, who's Head of Government Relations and Corporate Planning at the Art Gallery of New South Wales. Emily, I imagine you've been working tirelessly to get the Art Gallery of New South Wales into a position where it's able to open to the public on Monday. We're delighted that you're able to share your knowledge with us and with the sector today. Please take us through your State Gallery's approach to the easing of restrictions and reopening. I think we need to hand over the presentation to you now.
Thanks, Beck. I'll just wait to share my screen. But don't think I've got the ability to do that yet. So there we go. And I hope that you can all see it coming up very soon. So I'm at the Art Gallery of New South Wales, just while this screen is coming up. And as Beck's indicated, we've been working on our preparations actually since we closed. And then that's been escalated in the last 10 days or so since we became aware that we would be invited to open from 1 June. So it's been a very compressed timeline, like everything in relation to COVID. So we have been very much learning as we go, as well as I know that all of the sector are currently doing. So I'll just walk you through what we've been, how our planning has proceeded. So this has just got a little bit of a delay on it. We're really starting as small as we can. There's two reasons for that. Partly because we want to slowly return our staff to the premises. The majority of our teams have been working off-site for the last couple of months. And we also want to, and there are a lot of our activities which we can't reopen yet, but we also want to take the time to observe visitation levels and behaviours and see what our visitors are actually expecting of us, not only in terms of what our offering is, but in terms of what measures we're putting in place to keep them safe. So we've tried in our planning to develop an overview with phases, a phased reopening, which is in line with the national framework as much as possible, and then has subsequently been drawn from the New South Wales Health checklist, which we've had in a draft form for a few days now, as well as safe work checklists. And one thing I'd observe is that the New South Wales Health checklist has been extremely helpful for us with our planning, but it doesn't necessarily touch on a lot of the back of house activities that we're doing. So we are developing, in addition to front of house and office space measures relating to physical distancing and hygiene and infection control and staff and visitor wellbeing, we are also developing specific activity-based plans for our installations, for conservation, for events once they resume, and for when we're working off-site, including installing touring exhibitions at your own facilities in a lot of cases. Our staff have been really central to this planning, and I would really encourage you all, you know, you've got teams of different sizes, but to involve as many of your staff as possible in developing your plans to make sure that everybody has a comfort level with the measures that are being introduced, and that the path that you take is something that everybody understands the rationale for, and can support and embrace day to day, because it counts on everybody understanding what they need to be doing. So we've done that through surveying our staff on what their expectations are for returning to the gallery. We've developed quite a detailed handbook which outlines a lot of the measures that are covered in the guideline, in the checklist rather, and I'm very happy to share that with all of you after this. It's obviously been developed specifically for the Art Gallery of New South Wales, and it will continue to evolve as government guidelines also develop, but it may assist you with your planning. We've also kept in contact with regular email updates and of course virtual meetings to keep everyone up to date, and we've tried to take a very empathic approach to all of this planning because our people are so important to the work that we're doing, and as I said, we really need to make sure that they come with us. I've just skipped to an overview. You should be able to see that, I hope. I'm not going to go through this in detail. Again, I'm very happy to share this with you separately after this, and some of you may have seen it already, but just illustrating that we've got a multi-step process, and we are just about to embark on Monday on step 2, where we open with a timed ticketing process and just our collections and collection-based exhibitions in the Biennale of Sydney only. We're not having events aside from a few small private events, which I'll touch on in a minute. We aren't offering public programming of any kind in our first phase. Our cafe, which has a reasonable capacity and has an appetite to reopen, will be open with up to 50 people, and they've been working very closely in line with the restaurant and cafe guidelines and checklists from health. As I said, we're going to have collection exhibitions, cashless retail. Our volunteers will not be on site in the first instance. There are a number of them who are very keen to come back to us, but we want to see what visitation patterns are like before we get them back on site. And we're going to be sharing our handbook with them also. And we just want to make sure that all of our ducks are in a row before we start having volunteers come back in, because it's just an additional measure to be considering, and we want to make sure that we do that right, especially as a lot of them are vulnerable categories. Our members' lounge will be open with very strict measures in place. Our library remains closed because it is and that's mostly it's based on the physical capacity of that space. In the first instance, we want to just have a slow return. And the Brett Whiteley studio, a lot of you will know, in Surrey Hills we operate as well, and we're using most of the same measures, but we're not using time ticketing there. We don't have the capacity. So they've developed a Google Docs document which they'll add to anytime anyone comes into the museum. So although we do have the online system for the gallery at the Domain, Brett Whiteley doesn't have that approach. So I've just got an overview next of our measures that we're taking to keep people safe. And I think that this may help you if you're looking at sort of communicating with your people and ensuring that you have all of these bases covered. We broke everything down again into hygiene, distancing and wellbeing and infection control. And again, I don't think that I necessarily need to go through most of these because Michelle did touch on most of them, but I would add that we've made quite considerable workplace adjustments in back of house with rosters and alternating seating and a 50-50 approach to teams where we only have a maximum of half of the team on site at any one time, and that's in the event of an infection occurring at the gallery, that we can continue to operate if a number of staff need to go into isolation as a result of that. We've got an infection control plan. We've taken the decision not to provide, to use thermometer scannings. We don't think that it's reliable enough to support that in our context, but we do have thermometers and PPE available to our staff on request and obviously for use in first aid. We've closed off a number of things which aren't touched on in the checklist. We've closed our water fountains temporarily and built into our messaging that our visitors need to bring bottles of water and to be prepared for, you know, a slightly different experience. We also don't have any cloaking in the first instance, again, because we just want to manage the groups coming into the gallery. For those who are familiar with the building, it's quite a narrow entry. We have opened a second door, but we want to make sure that that process of coming into the space is as safe and as non-clogged as possible. So we've got floor markings, bollards, and one-way entry and exit, and of course displaying space limits and using some signage, which I'll get to in a moment. You should be able to see. We've then got a second piece, so that's the outward facing, and then we've communicated to our teams what we're doing to keep them safe, both on site in the public areas, but also in the back office areas and back workplaces. Any of our guests who come on site are registered with security. We have emphasised the benefits of the COVID Act, but of course we have not made that a mandatory thing because that's not appropriate. I think most of these, again, I'm happy to share this offsite and I'm offline and I'm aware of timing, but we're very much emphasising stay home if you're sick, avoid contact face-to-face, and we're supporting virtual meetings as being our ongoing standard operating procedure for, you know, the foreseeable future, which is in line with government practices. We're part of DPC, but also just to support those who continue to work remotely. The other thing I would say is that we've gone to some lengths to make sure that there's support for wiping down shared surfaces. We do have people who share equipment, whether it's tools in installation and building, or whether it's photocopiers and kitchens. So we've gone to a fair bit of trouble to stock those supplies. This next slide illustrates the floor plans that we've developed. It's coming soon, I hope. Which we've calculated the capacity of each space within the gallery for our visitation, and that's signposted, and also in our back office. And you'll be able to see on the right-hand side, you've got the number of staff who can be in a space in our office areas. So that is, again, being communicated and then supported through our teams to make sure that we don't have any more than that on site on a given day. We've kind of suggested that our staff treat their workplaces like workspace, like the treadmill at the gym, and they wipe it down when they arrive at the beginning of the day, and they wipe it down when they're finished, and don't assume that nobody's touched it in the interim. So we're allowing the 4 square metres per person. We've suggested mapping of diagonal zigzag seating. There will be some flexibility around that depending on which teams are on site, but basically the rule of thumb is that nobody sits in front of you, no one sits behind you, and no one sits to either side, and that achieves the distancing that's optimal for safety. This may not be appropriate for all of you, but we're using, because again, being part of the government, we're using this signage within our work areas. And again, we're just having visual reminders. I suspect that everyone might get signage fatigue, but we're trying to make sure that there are visible reminders everywhere of the safe practices that we're encouraging. and I'm just about to show some images of what that looks like in a working environment. This is not the gallery, this is in Department of Premier and Cabinet, but it gives you an indication of what we're going to be putting in place over the next, well, it's been yesterday and today. The gallery has also developed non-branded signage for our front of house so that there's a consistent look and feel. And again, I've spoken to Beck and her team about sharing this with all of you, and we're very happy to pass it on. There's no sense in reinventing the wheel, and we think that this covers off on most of the conditions that everyone needs to meet. So again, very happy to pass this on for you all to use in your sites. There's just another example of back office signage. To manage floor markings, we're using the most simple process possible, partly because we have quite sensitive marble floors that we don't want to damage. But this, using yellow painter's tape, it's durable, we can move it around quite easily, and it's high visibility, so it may not necessarily be the most aesthetically soothing solution, but it means that we've been able to mobilise this within a 10-day process. So anyone who comes to the gallery will be seeing various iterations of this in certain spaces. I've just got some images of the response to the gallery's reopening, and what I wanted to emphasise is that we've taken a really positive approach to this in the way that we talk to our staff and to our stakeholders. We're really excited to be reopening, and we've tried to emphasise that the gallery is a safe space for people to be. It's important for people's emotional well-being to have somewhere like the gallery and like all museums and galleries to go to in their community. And so we've had a very strong positive response from our stakeholders and very little concern voiced through our various channels of social media and emails about safety measures. So we're quite happy with the way that that's been responded to in the community, and I think that emphasising all of the things that we are doing for you and making that part of your communications. We've got quite a detailed list on our website for anyone booking their tickets about what is required, so that they've got clarity about what their expectations are when they turn up. And there's actually been minimal concerns about the ticketing so far, so we're hopefully optimistic that it will roll out well on Monday. The other thing is that we are doing a test drive this afternoon with a number of stakeholders who are visiting the gallery for a sort of trial run to see how they respond to the signage, whether it is confusing to them, and then that will feed into any last minute sort of revisions that we make in advance over the weekend in preparation for 10 o'clock on Monday. So yeah, as I said, very, very happy to share this information, and good luck to you all.
Thank you, Emily. That's so great. We really appreciate the resource that you're going to be able to drop on us, which I think will save a lot of time and research for a lot of our smaller museums and gallery spaces that don't have the kind of capacity that the art gallery has to deliver this kind of material. There are just a couple of questions that have come out of your conversation. The first, I think, is related. Suzanne asked about whether theatrettes inside museums are to remain closed. I guess this also relates to Michelle's answer to a range of questions around gatherings and that 4 metre square space that is able to be utilised.
Yeah, the gallery, we're not intending on using our theaterette space until the restrictions are lifted that can support that. That is part of our plan for phase 3 of programming. That timeline is obviously a highly flexible one. It originally had 1 July as the beginning of phase 2. So we're going to be responsive to what is required. I mean, the interesting observation from our teams is that the theatre-based seating, once it's considered safe, will actually be one of the simplest parts of our operations to manage social distancing by blocking off seats, doing disinfections in between sittings. And we've got an intention of keeping those programs, those seated programs, quite limited in time in the initial phases once health determines that that's okay to open. So that is going to be one of the first planned public programming. Because of the space of the gallery, a lot of our floor talks, people naturally bunch up. So a controlled environment would probably be best for us in the first term. But again, we're going to work hand in hand with government.
Thanks for that, Emily. A couple more questions. What are the regulations around soft furnishings in public gallery spaces?
I would love to know. We are responding to that. We've removed some of the seating from within our gallery front of house area to facilitate safe and trying to concentrate on materials which are easy to wipe down. You know, we are aware that people sometimes come in groups and you may want a family to sit side by side on a bench. So we're not necessarily blocking off anything that accommodates 2 people. But again, we've got signage which supports people staying separate, and our staff, we are cleaning down high touch points. So the areas where there are soft furnishings that we've got the ability to move or replace, we are doing that. But you know, there are some instances, and we've actually made some, I should say, we've made some modifications to our current exhibits. There's a number of works within the Biennale where we've tethered fabric which was hanging low and could have been contacted by visitors. So, and we've removed headphones for the time being, as well as putting any, we had a number of iPad-based displays and they're now on a loop, and so they don't require any interaction from our visitors. And we've got signage that supports that. So.
Just one more question in regard to numbers of visitors. This is from Tim. How will you manage the numbers in smaller spaces? Will people have to queue to enter a room that has reached capacity?
Yeah, we're dealing with that in a number of ways. So we're monitoring visitation to the gallery using our security system, and that's for the gallery as an entire building. But we will have security officers and front of house staff stationed in certain points where we think that there's likely to be larger numbers of people trying to go into the room at once. As I said, we've got signage which will be displayed at the entry to each of those rooms and within those rooms, so people do understand. We have an expectation that people will also, and we've also on our website encouraged people that if there is a large group of people in a given space to consider coming back when it's less crowded. But we are encouraging, asking our security team to help support that just by, and they do that already, just if there's a large number of people, they're used to asking them to just sort of move aside and if they can just wait for it to dissipate.
Thanks so much. Last question from Linda, it's kind of more of an observation. She's very impressed with the plan, just wondering if it'll be a good experience for visitors.
We hope so. What I would say, one thing I would say is that our public programming team have been working on alternative ways to engage our visitors in the art. Again, some of those plans are still in development because this has been such a compressed timeline. They actually do have intention, and we've had discussions through Department of Premier and Cabinet about the requirement for no paper-based materials. We actually are hoping to develop some single-use paper-based materials to give people a guide, treasure hunts through the gallery for children, and but the intention is that they will be very strongly encouraged to use it and dispose of it, which is not hugely sustainable in terms of the environment, but for the time being, we think that that's a good alternative to having the floor talks and the other activities that people are used to experiencing when they come to the Art Gallery of New South Wales. We do have digital programming being developed also, but we want to try and get a happy medium.
And there's another compliment here from Linda saying she thinks the gallery's online response to COVID-19 has been outstanding.
Thank you, Linda. One thing I would say also, if I can just, we've done Together in Art program, which is our online engagement program, and that's going to continue because the response has been so strong from the community.
Yeah, it's a really wonderful program, and a lot of the people that we've been talking with about digital programming have been citing the gallery's online program as the sort of gold standard. So thank you so much for providing this resource.
Thank you.
And talking with us today. We're going to now move on to Julie, who's been very patiently waiting. So please welcome Julie Baird from Newcastle Museum, the director there. Julie, you've got a plan to open later this month but you're looking at a staged approach to opening. Can you talk us through your approach and what's informing your thinking?
Well, I guess, we're City of Newcastle funded, so we're a locally government funded organisation, and they're large funders of culture. So we sit in a suite with a theatre, an art gallery, the museum, historic heritage fort staffed by volunteers of men over 70, and a lot of libraries. So we started from the same basic premise of risk assessment. So we went to the NCCC COVID-safe workplace plan as an initial spot to go through, and that's predominantly more a tick box about your staff and your back of house working arrangements. We're council, so our next stop was, of course, a risk assessment form, because we love those things. We ended up doing those two sort of risk assessments, and what we realised is that each individual institution was incredibly different. We all had very different risks, we all had very different patterns of visitation, we all had very different internal feelings about opening as well. So we went through, and a lot of the stuff that the Art Gallery of New South Wales is doing, we're doing on a smaller basis. The museum found that our largest risks were predominantly interactives. So we have a science centre, we have interactives in all our social history galleries. So for us, it was about how do we alter that and make those things offline. Some of the other stuff that we found was that when we did our grid patterns, we had certain pinch points. So our BHP Sound and Light show, which is quite a popular thing, it's a pinch point of 15. So when we're considering numbers, even though we have a really large space and you can have people flow through, really it's the smallest spaces that ended up deciding how we were going to go. And we decided to be quite risk averse. So we're looking at a staged approach. We're talking about staff coming back hopefully at the beginning of June. We're talking about visitors coming back in a ticketed only entry, and we're doing mornings only. And that's predominantly to manage our staff, to manage our space, our cleaning regime. We have a total EFT of 12.2, so we need to make sure that we have enough time to clean and de-stress staff. Some things we're doing more of. So, because the BHP show is popular and we can fit 15 people in, we have 1 hour time slots for 45 people, and they get a time slot that they can view this theatre experience. We've found that we've engaged with all the members of the staff, and that's been quite useful. We still have some staff who are quite anxious about it, but we have the ability, because we're maintaining online programming only, to keep some of those staff in an online work from home capacity. And I think it's that ability to actually listen to people's concerns. We've had to physically alter the museum. We've had to only allow people through one door. We've had to change our visitation desk. We've had to take all the paper brochures out. The sneeze guards, we've had to put up sneeze guards in readiness, and we've had to move exhibitions. So I actually am feeling like, as a regional museum, we're in a pretty good position now to keep our staff and our visitors safe. I actually think that we're in a good spot for that. I guess the thing that I'm probably most concerned about is the comms. And so, we are completely altering how our visitors engage with us and how they always have. And through visitor evaluation over the years, what they want from us is often quite different from what they want from the art gallery or the library. And we've got those statistical things. So we have multi-generational groups for longer than 2 hours who want to socially engage with people they don't know, and they want to touch stuff and see new exhibitions. Well, we've cancelled our June-July program because we were working to a further date down the track. And so, I guess for me, that's our biggest concern, is in order to minimise risk and to sort of maintain the best results, we're offering quite a light service. No interactives, mornings only, no programming, no theaterette, one set of toilets, no water fountains, no cafe, And so we're going from a place where everyone comes for a really great time and they get into it and it's fun and wild to follow the lines, follow the dots. And I guess that's my concern from a staffing point of view, because we will have our visitor services officers there, and there will be people who turn up, or you know, we've had people who want to book oldies bus tours in because they heard that the museum was open. And so now it's a case of managing those comms, and that's where that support from the larger organisation really is going to come in handy. And also the fact that the council acknowledges the difference between how people relate to the different spaces. It's much easier to have a hands in your pocket experience at the art gallery than at the museum. And the respect of our professional knowledge about visitors and that kind of thing. And you can always expand. You can't edit back as easily as you can expand. Anyone who's installed or deinstalled a show knows that, you know, installation takes 3 times as long. So we're going to install small and spread out. And our next stage, we're hoping that we'll be in a position to expand out to school holiday programming, perhaps for September school holidays rather than July, with limited social distancing and larger numbers and more staff on site by then. So now we're just waiting on the approvals. So it's all in, and now we're waiting to see whether or not we can open. We know that the art gallery in Newcastle has received approval for opening earlier than us. We know that there's certain library stuff that's going ahead. And so, yes, we will await for the museum results next.
Yep, so you've got a whole range of different processes to go through as a council LGA, and you know, there's a whole bunch of checks and balances that relate specifically to council, as well as the New South Wales, I guess, health orders.
And it's funny, I found that you know, when I'm sitting there listening to what the Art Gallery of New South Wales is doing and the amount of difference in staffing and that kind of thing, you know, for me it was quite nice that utilising those kind of resources that a lot of smaller institutions have available have been really useful. And we're doing that to help support the Fort Volunteer Initiative Museum on how do they open, you know, with the vulnerable staff and with smaller spaces. And more difficulty in counting visitors. Online ticketing means that, you know, for us, we're going to say no ticket, no entry, which seems quite strong. But that way, then we can maintain that information about who has got their try booking Eventbrite tickets online. And that way, we don't have to put the pressure on our staff in order to perhaps feel a bit confrontational with asking people for their personal details.
Can I ask you a question on that, just in relation to, I guess, accessibility, because some people don't have good internet to book. Do you think you might be able to make available a system for booking on site? And
certainly the art gallery is doing that. So they're going via, they'll have that many people that are booked. And then if someone comes to the door and there's available space, that their staff can take the time to book them online. This is something we're still considering. For me, you know, the simpler message of no ticket, no entry seems to work. We have a very high disability visitation at Newcastle Museum, and carers as well, but we haven't found that the online booking has been an issue at all for our visitors. We're using the same system that we would do for a school holiday program that's free. So we're still a free service. It's still the ability to get out and do something and see the museum. We're also taking the opportunity to tell some local stories. So we've got a possum skin cloak exhibition that we're moving out of an interactive space into a different space in order to engage people with, and also through windows so you can see the exhibition even if you're standing outside and it's night, and also a history exhibition about the history of fires, which seemed very current, very quick turnaround at the time, but now no one's thinking about fires anymore.
I'm sure that will all change as we gradually sort of emerge back into the world. I now encourage anyone that has a question to ask it. I do understand that we are now 5 minutes past 11, and we've had some wonderful, incredibly useful presentations. I did want to pick up, Julie, on what you were saying about, I guess in the regional context, we understand that a lot of organisations rely on volunteers that now are sitting right within that vulnerable kind of position in relation to COVID-19, with our wonderful senior volunteers that really are the kind of heart and soul of galleries and museums in regional Australia. Do you see a sort of shift to trying to encourage volunteers from different demographics to start to engage with the spaces that you're running?
Yeah, and I think it also is one of those things that often with volunteer-initiated museums, there's volunteers who have been with the museum for a very long time and have a lot of corporate knowledge. You know, for us, we are looking at utilising non-vulnerable volunteers. So for us, it gives us an opportunity to get, you know, the students, the work experience, the, you know, we have some who are parents who work at home parents and come in every once in a while. And we're encouraging people also to do online stuff. So our story times that we do every Tuesday morning, we've had volunteers phone in from Canberra and videotape from all over the world after they've sort of had to leave the organisation. So I guess for me, it's an opportunity to perhaps give positions of responsibility perhaps to younger volunteers who might have been sidelined in the past. And it's one of those things that you need to, I guess it's one of those things that I don't want to end up on the front page of the paper. I don't want to be the person that started the second wave. And so I might be being risk adverse about some of those things, but I think that it's probably better safe than sorry. And hearing from Create New South Wales and New South Wales Health about options and possibilities. I guess I would encourage volunteer-initiated museums to really thoroughly plan. Happy to share our risk assessments or anything like that to people in case there's something they haven't thought of. And so be prepared, think twice, act once, stay safe. And there's always so much work to be done in a volunteer-initiated museum, even without visitors. There's so much collection management that can be done during this time. So yeah, that would be my advice.
Thanks so much, Julie, and thank you to all of the presenters today. The sector's going through a very challenging time, and this is really useful information for us all. So Emily's going to share the Art Gallery of New South Wales presentation. We will put that on the Create New South Wales website, and I'm hoping that we create a portal for information so that Julie's planning can enter into that space and will be useful for the regional gallery, regional museum context. We also hope to make some fact sheets available, and from this webinar we'll also collect your questions so that they can come into a frequently asked questions page. We also understand that this checklist from New South Wales Health will come in shortly, and we will put that onto the website too. So we want to encourage participants from the museum and gallery sector to let us know when you're thinking of reopening, and talk with us about your planning and any concerns that you have. If there are other topics that you want us to cover in webinars over the coming weeks, please do get in touch with us on email and phone. So I'm putting up my details. Hit me with your requests. We're really interested in hearing from you. We're also developing a survey for you so that you're able to talk to us about when you're intending to reopen, what the processes are that you're putting in place, and any concerns that you might have, so that we can collect that data. Thank you so much for joining us today. Again, it's been a very challenging time for this part of the sector, and I'm really glad that you were able to join us today and get this information. We'll get it out to you as soon as possible. Thank you so much.